So this is so this is a tough topic on many fronts, emotionally, socially, financially, legally, and ethically. And so we'll be tackling some basic just information for you guys, but then we're going to go deep dive into two case presentations, one focusing on abuse and the other focusing on neglect. And then hopefully we'll have a rich discussion of best practices. You guys are coming from a variety of different perspectives. And so we have some recommendations, but would like to have your input as well. So the five main categories that we're tackling in terms of child maltreatment, and we're using the broader term of child maltreatment because it includes physical abuse, emotional maltreatment, neglect, sexual abuse, and exposure to family violence. Oftentimes, when we see these five categories, from the ethics literature, from legal practices, and from clinical practices, having these kind of buckets helps us understand what pathways to approach, but keep in mind these are not distinct. They may overlap in some critical moments where emotional maltreatment and neglect, for example, will overlap. So just because we have these categories, it doesn't mean to say that an individual could not be experiencing actually all five of these. The subtypes of childhood maltreatment, we borrowed this from actually University of Queensland had a really nice report on trauma-informed behavior, and it was a practical guide and support document that really called attention some of these areas that oftentimes you will see overlooked in more of the scientific literature. And so practice-based literature that we are alluding to hones in on more than just child abuse slash child neglect, which you often see. When we start taking a deeper dive into what those components may be, as you see neglect, abuse, household dysfunction, particularly if you look at the far right of household dysfunction, um, mental illness, both on the individual child's part, a parent, a guardian, the family dynamics that we need to consider. It's not an all or nothing. The child's abused, neglected. There's obviously circumstances that may be relevant. Incarcerated relatives, substance abuse, oftentimes mother or a parent is treated violently even including divorce. And so, beyond what you typically see in case-based reasoning and initial jurisprudence discussions on physical and emotional neglect and sexual and physical abuse, this household dysfunction category really calls to attention the social determinants of health. And both Daniel and I will be tackling not just our cases from the basic definitions of neglect and abuse, but we'll call attention to much of what we've experienced with our children, both in the clinical setting and legal setting with household dysfunction. The general statistics in the US, there 1 in 4 girls and 1 in 13 boys are estimated to experience child abuse and neglect. Daniel and I had discussions prior to this presentation, and Daniel, feel free to pipe in. We are based on our experiences, we're likely seeing that the statistics are actually much worse, particularly with the male population.
Yeah, I would suggest and hypothesize that men, especially younger boys, because of the expectation that they quote unquote suck it up, are less likely to report some of the trauma that they're experiencing at home.
The National Children's Alliance, the last review, they actually did a very thorough review back in 2022. Granted, we're seeing more recent cases, but that's the most recent. And they estimated more than over 550,000 children are known to, and this is just known to U.S. authorities to be abused, which amounts to about 8 out of every 1,000. But like we said, we're we're likely seeing that this is just an estimate of reported cases, and that many cases do go unreported. And most of these children do experience some type of sexual abuse, and usually that sexual abuse is experienced within the first year of life. Nearly 2,000 children have died from abuse and neglect in the US alone just in 2022. And again, that's the latest statistics that we do have. And then half of the US population of children living in the US have experienced trauma. Going back to my previous slides, that trauma can be confounded by incarceration, divorce, etc., that impact mental, social, spiritual, economic, and physical well-being. If we take a look from the Department of Health and Human Services, here's just an outline of the number of cases back in 2022 by age groups. Um, this is just child age up till 9, and I wanted to show this illustration, this graph, just to present the fact that so many cases are within the first year of life.
Yes.
25K to 35K per age group.
And on the legal criminal side of this is a lot of what is formerly known as shaken baby syndrome, is what I see and what I do, which is, of course, when someone traumatizes an infant by shaking them out of frustration or anger or what have you. We see a lot of skull fractures and issues with the neck and things like that that can lead to severe and long-term health issues cognitively and physically.
And oftentimes, the mother might be blamed for shaken baby syndrome or equivalent behaviors, when in fact, some of those behaviors are elicited because of significant maternal abuse in the home. So detecting abuse, I'm glad we have a lot of practitioners on this session, because I'm sure in our discussions you'll find that detecting abuse can be a challenge. It is not necessarily a black and white easy diagnosis, here's your differential. And so we outlined, and this list is may not be exhaustive, but we outlined the physical, behavioral, emotional, and sexual abuse signs that we've come across, we've seen throughout the literature, we've seen in obviously the legal cases, ethics cases, and so by no means this is exhaustive list. And I am sure in some of your own experiences, you're seeing a lot more. I'm not going to read through all of these, but just call attention to certain ones that both Daniel and I have experienced. The physical signs, one that has come up particularly in the late adolescent teenage cases that I've seen. The wearing of long sleeves or other clothing inappropriate for the weather to hide injuries. So, it might be really hot outside and somebody's wearing a turtleneck. And, just a question, are you too hot? What's going on here? Some of the behavioral signs that you see our extreme fear of a specific person or reluctance to go home. I just had a ethics consult about a year ago, and when a boyfriend of a parent came into the hospital, it was a very clear, visible reaction of that child when that individual came in. And so that prompted further discussions, actually. Our pediatricians were right on that, very much paying attention to body language. Some of the emotional signs, the frequent nightmares, the trouble sleeping, lack of interest in school activities or friends when that interest did exist at one time, and then the more unfortunate sexual abuse signs where, uh, again, the fear of certain people and places, um, pain, bleeding, and knowledge of sexual behavior inappropriate for their age, even going so far as individual patients that exhibit unusual or heightened sexual characteristics and sexual behaviors that are mimicking a particular parent, guardian, or abuser. And Daniel, if you want to chime in on things that you've seen.
Sure, sure. So I would say the top two things I see in terms of physical signs are, of course, those unexplained bruises, burns, or fractures. What we've been seeing a lot of is a child will be at the doctor's office being treated for something, will undergo some testing, and then the medical professional will observe an underlying fracture, an underlying physical injury that is in the state of healing. And when the parent is asked about it, they can't explain it. And then further assessments are done to determine exactly where that came from or what is going on here. And in the worst of scenarios, we find out that it's due to prior physical abuse. As far as sexual abuse goes, I agree with Dr. Altman. I most often see knowledge of sexual behavior that's inappropriate for their age. Children drawing pictures of genitalia in school, children mimicking sexual activity with friends or peers. We see a lot of that. But those are my top two that I notice.
In looking at neglect, and we have a case that illustrates that. I would personally, just from experience, argue that sometimes this can be harder on healthcare professionals to understand the neglect that may be going on at home at times if there are no clinical findings, such as nutritional deficits. And so the first one, constant hunger, hoarding food, begging for food, where you can start detecting nutritional deficits, can help. But where it gets a little tricky in terms of duty to report, and we're going to talk about, ethical duties and legal options. The duty to report, the duty to say something can be quite tricky when you see a child that's dirty and unkempt, has hygiene issues. You may know some circumstances that they're in. They may come from impoverished areas, underserved areas. And so the question is this about neglect or is this about the location? Again, the inappropriate clothing for weather, frequently left alone, unsafe environments. We've had several cases in our area of kids coming from homes that have hoarding problems, hoarding issues, both animal hoarding and then physical object hoarding. Consistently late, absent from school, again, isolated social events, and then unattended medical or dental needs. We're seeing growing unattended dental needs as triggers because the child may get medical care through, a variety of avenues, not necessarily having a consistent pediatrician, but maybe going to urgent care and so forth to get their urgent medical needs met, the earaches and things like that. But when it comes to dental needs, that's often overlooked.
And to Dr. Altman's point about hoarding, we also are seeing that in our jurisdiction, so much so that, in fact, there's an animal charity organization that investigates cases of animal hoarding and neglect, and they were actually given body cams because what we are finding is that, especially when there's children in the home, there's usually other forms of neglect happening with regard to those children. And then, in terms of being consistently late or absent from school, we know that a lot of children run away from home due to the home environment that they're in and trying to find safety and leaving because of fear. So if a child's frequently absent from school and they're a known runaway to law enforcement, that's something that needs to be investigated further. So I just want to talk a little bit about some of the legal issues that we see. I'm sure everyone on this call, for the most part, is aware of the mandatory reporting laws. I put the Ohio Revised Code section there in case you'd like to see, am I really included? Am I really a mandated reporter? I would assume you would know if you are, but some people might not. Mandated reporters involve, of course, all medical professionals, teachers, pretty much anyone that in a professional capacity is interacting with children on a regular basis. Attorneys, of course, are also included in that. And it's really easy to make a referral to your local children's services board or agency. Typically, they'll just have a phone number you could find online. You call, they have a few questions, and at least you're satisfying that duty. So I would always encourage if there's any suspicion, just make that referral. Um, when I say what I'm about to say, this is my personal opinion. This does not reflect the office that I work for. We know that children's services agencies are overworked, often underpaid, and sometimes issues kind of slip through the cracks. But again, as long as you're making that referral, you're at least satisfying that duty. And of course, Child Protective Services is mentioned here as well, because they do play a huge role. And those that work there that really care a lot do a great job intervening on situations that need to be intervened on. In terms of court involvement, when we're looking at neglect and abuse, one of the first things that happens when it is determined that there's an immediate threat of harm to a child is what's called Ohio Juvenile Rule 6. That is when a juvenile is actually removed from the home pursuant to court order or the order of a law enforcement agency to prevent immediate harm. And if there are other children in that home, those children can also be removed because it's not necessarily just one child that is being neglected. The issue may have been detected with that one child, but it's often extended to other children. We will see both civil liability and on my end, what I do specifically, criminal guilt is found with people that are accused and then confirmed to have been neglecting or abusing a child. In terms of civil liability, we're thinking about compensatory damages. So money being paid for physical harm, emotional harm, medical bills, mental health bills, things like that. Criminal conviction obviously focuses on incarceration, protecting the public and other children from further harm. And we'll talk about that just a little bit more in a moment. There are, of course, rights of child victims to file civil lawsuits. There are statutes of limitations. However, those statutes of limitations account for the fact that children are not thinking about reporting these things or actually seeking legal action until a much later date. So, for example, for child sex abuse in the civil law, that is after 12 years after they reach the age of majority. So that would be 30 years old. So a child that is sexually abused at 7 or 8 still has until 30 years of age to actually seek restitution or damages for that harm. And then I also mentioned Marsy's Law here. Marsy's Law is something that was recently codified in the Ohio Constitution. This is all about protecting the privacy and the rights of victims of these crimes. So if there's an ongoing court case in criminal court, a child, through whatever guardian that has them at the time or through a children's services agency that has custody of them at that time, is notified of these hearings, has the right to actually appear and be heard. And what I do my due diligence to speak with that child, especially when it comes to, at the end of the day, what is going to happen in their lives and in their parents' lives, about what they would like to see happen. I can't always do what they would like for me to do, because at the end of the day, my duty is to the public. And my interests don't always go in accordance with their interests. Nonetheless, under Marsy's Law, I have that duty to try to get their input and their insight and do what I can to achieve that. So that is something that we're doing on the criminal side and on the legal side, but it goes in step with, I'm sure, what Dr. Ullman is going to talk about soon, which is the privacy and confidentiality of these children. So kind of digging a little bit deeper into the criminal versus civil liability. On the criminal side, when we're talking about physical abuse, we're talking about assault. When there is serious physical harm, and that is that consists of many things under the law, but we're talking about deep lacerations. We're talking about states of unconsciousness, extreme suffering. That is what's called felonious assault. And then we think of our domestic violence laws as well. Whenever there's that family or household relationship, that parent-child relationship, that type of physical assault is domestic violence. Of course, our sex offenses are also included here. Rape. When we think of molestation, the common term molestation, that's called gross sexual imposition under the criminal law. And of course, unfortunately, there's a lot of child pornography that we see in our office, whether it be parents that are actually, unfortunately, using their own children to create and disseminate child sex abuse material, or individuals that are possessing it, in possession of it, and disseminating it, getting it from online sources. There are whole agencies devoted to investigating those cases and then passing them along to the appropriate agency. But those are some of the sex offenses that we see. When we talk about neglect, not getting appropriate medical treatment for a child, abandoning a child, those all fall under endangering children under the law. This even includes a parent who is drunk driving with their child in the car. Anything that creates a risk to the safety of a child typically falls under endangering children. And of course, the outcomes do vary. If there has been any type of financial harm, then a parent or guardian might have to pay restitution. We will call that financial compensation restitution, whereas on the civil side, we call it damages. So when we look at the civil side, we're talking about financial compensation for those medical expenses, care expenses, emotional distress, and pain and suffering, which is that physical harm. Sorry, we can go to the next slide. Yes.
All right. So many of this, the ethical challenge and the rights of the child. So these are the challenges that we face, whether you are a pediatrician in the community, whether you're a drug addiction counselor, a legal representative, we're always going to be confronted with some of these ethical issues. And one of them is the right to privacy. And particularly children who are of adolescent, teenage years desperately want to have their stories told. They want to have a voice, but they also want to have that privacy. And the challenge is how to maintain the respect for the individual who is sharing some deeply, often very troubling instances of abuse and neglect. And as mandatory reporters, we have to report. And so doing this in a sensitive way that does not disable the trust and bond that you develop with that child is so critical. And so taking things at a step-by-step basis, and Daniel could probably attest to, like, the courts need this information ASAP. We need to act now, but sometimes we do have to take things in baby steps to develop that trusting relationship. In conversations that I've had with more of the adolescent teenage victims of abuse and neglect, or suspected victims of abuse and neglect, having those discussions open and honestly about the limits of privacy, that these are limits because of the need for not just the safety of the individual, but then public safety, sibling safety, and even parental safety in many cases. I talk about the rights of autonomy and informed decision making. The best thing that providers and first responders and individuals that are aiming to help and support um, victims and suspected victims is to keep individuals that have the capacity to understand, and that's at a variety of different ages. Not assuming that just because you're 7 years old you do not understand, or if you're 15, 16, that you do not have the opportunity to weigh in on decision making, is to keep the individuals informed at a level that is commensurate with the knowledge, the education, but also the sensitivity as to what they're experiencing. And so informed decision making may not may not be able to go through formal consent processes because of our duty to mandatorily report, but indicating that, we will do the best we can to make sure that personal needs and values are met. Some of the best conversations to have when you know a child, for example, may be removed from a home, is to understand what are their goals, what are their values, what are their likes and dislikes. If it is their favorite pet rabbit that they do not want to see left behind, is there a way to get their favorite pet rabbit with them as they may be placed in foster care? So these comfort measures, personalized care, are so critical to supporting autonomy when those rights may be diminished. And I use that example as a real example that we did have. The element from an ethical standpoint of more of a person-centered approach comes from a justice theorist, Martha Nussbaum, and her focus was on human flourishing. It's not just about rights, it's not just about duties. It's about making sure that the holistic person is taken care of. People do have the rights to bodily integrity and not to be harmed or sexually abused. They do have the right to have that safety. But in addition to that, from a human flourishing standpoint, how do we do this in a more holistic way that respects not just the physical and emotional and mental aspects of a child, but also culture, spirituality, their social and financial standpoint. Some of the greater challenges, and Daniel and I have had these conversations of vast differences among families due to their cultural beliefs. So something as a parent that uses a switch, basically to spank their child, and put them in the corner, one household may view that as normalized behavior, while another household would say that is child abuse. And so, making sure that we understand the cultural phenomenon and to understand what is the actual intent of the harm being done, to better understand and help support perhaps a parent that needs that support of parenting skills.
And just to briefly add to that, I will say the law, in some aspect, does take account for those spiritual or cultural differences among families. There is a carve out exception under the child endangering statute, for example, that prohibits criminally punishing someone for choosing to use prayer or recognized religion as opposed to medical treatment. So there are little exceptions here and there to that to account for that, but not as robust as we would like.
Other ethical dilemmas that emerge, and this is definitely an opportunity for our post discussion for you guys as providers to weigh in on, but the issues of misdiagnosis and trauma-induced consequences of that misdiagnosis. Um, in my experiences of doing clinical ethics consults, of navigating through residency training, and helping residents understand more about the issues of child abuse from ethical and legal standpoints, one of the issues that continue comes up is, hey, I suspect child abuse. I see some bruises. I'm going to automatically call CPS. When in fact, what it turns out is that not enough information has been collected, not enough clinical evidence has been collected to actually make that assessment. And so then we oftentimes do traumatize the child, the family in the process because we're not collecting enough information and making oftentimes those snap judgments without finding a little bit more. And so the dilemma is we are mandatory reporters, but if we're reporting based on snap judgments or initial quote unquote gut reactions, we're not doing due diligence and we're not helping our legal friends. We're not helping the Daniels out there, because we might have lost critical opportunities to collect enough evidence and support. The other issue is false reporting of cases, and this has been more interesting in my area, not so much from the child point of view, though the child ends up being the victim of this, but I've seen healthcare professionals being accused, being reported to the state medical boards for a variety of things, including child abuse, child neglect of their own children, when in fact they may be going through a very nasty divorce. We actually have had a couple of cases where false reporting cases was to purposely hurt the other parent or other guardian so that they would not be able to have access to their child, through the legal standpoint. Nope, sorry for crazy dog. The other is I'll actually have Daniel pipe in on that one. So
Oh no, I was just going to say, so before I worked as an assistant prosecutor, and I still see it now, but before I did this, I worked at community legal aid representing victims of domestic violence during custody issues in domestic relations court. And this unfortunately was a common tactic. Not as common as I think people fear it is, thankfully, but still I saw it a little too often where one parent would have their child make this wild accusation or claim their child made this wild accusation to get a leg up on the other parent in that custody action. So that is something that is hard to detect at times, but there are certain signs of coaching that medical professionals undergo training to detect.
The other areas, and this is where everybody on this Zoom call comes in. We need you guys. There's oftentimes a lack of mental health support, particularly post victimization, and whether it's throughout the legal procedures. And as you can imagine, the legal process can take time, leading up into whether it's a foster care or child returns back to home. There is a significant amount of lack of mental health support. Oftentimes, that support is right up at the front of the process of detecting, diagnosing mental or child abuse and neglect, but it's throughout the whole continuum. And so that's where having access to counseling services, support services, is so critical. There's also, as we mentioned, a general lack of understanding of cultural, social, and generational differences of parenting. And as healthcare professionals, clinical ethicists, legal teams, this is something that having cultural humility, but also recognizing the types of communities in our own backyard. So we have a large Bhutanese, Nepalese speaking Bhutanese population. There are several individuals from Guatemala that do not speak Spanish, but speak their own indigenous dialect in the Youngstown area where Daniel's, practicing. And so there's a need for us to really understand not just the cultural differences of language, but also parental behaviors, as well as the perceptions of and the fear and I would almost say the embarrassment and concern when a parent or a child are going through these things. So, and this is just from our experiences of Daniel's and my experiences. So, I mean, again, this list is not exhaustive. You guys are in the trenches as well. But our recommendations for mandatory reporters, first and foremost, being educated on the basics of child abuse and neglect. And I think we have due diligence to educate our medical students, nursing students, dental students, and so forth. I realize that in many cases it's removed from curriculum or we don't have enough time to teach this, but it is really critical. And to seek out training support for ongoing CME and so forth. I mean, having this opportunity even just to talk about it is helpful. Recognizing those signs and symptoms of abuse. And in the literature you do see differentiation, not just across counties in terms of training, but even among healthcare professionals and how they've been trained. Um, Avoiding bias and judgment, which can go both ways. The initial snap judgment, like I'm going to, treat every case as a abuse case versus, oh no, the Smiths, they're fine, they're good. They wouldn't do anything. Meanwhile, he's in a deep dark corner in the basement doing child pornography, which Daniel's like been seeing. Know the laws of the state and some of the up and coming laws. I think it's really important for not just mandatory reporting, but also best practices of protecting reporters themselves. Russell, I really appreciate the comment that you offered, or Daniel, even in the text box, that there's safety issues. There's safety issues for the people who are reporting and supporting the legal, administrative, clinical aspects of these cases. Um, More than anything, in all the consults that I've done, and Daniel, please chime in, document anything and everything. It's all important.
The only thing I would, unless you're in a professional position where you're a place to make this kind of assessment, um, the thing that I tend to see that hinders our prosecution of a case is someone commenting on the credibility or veracity of a child's accusations or claims. Document the claims, but you don't have to make an assessment as to whether or not you believe or disbelieve it or anything like that. That can really end up hurting a case where there is a valid, truthful claim of abuse or neglect. But yes, document everything nonetheless.
And don't confront the abuser directly without somebody else, without support. There have been violent cases against accusers. And so report with support. So a little tagline there. And then when appropriate, report and work with law enforcement the best you can, court, CPS, public health departments, and so forth.
So, guys, a quick question.
Sure.
It's granular what Daniel just said. That's really interesting. So, would you recommend something like, 'cause in some way you'd have to, as a clinician, you'd have to say, I observed this, and based on that, I did X, right? So, I guess something like based on this, there was sufficient evidence to suspect
Mhm.
child
Yep.
Yep,
abuse or neglect, and then that would, from a clinical standpoint, make sense to anyone reading my chart, and from a legal standpoint, it would help facilitate whatever direction it goes in, because all I'm saying is there was a reason to suspect.
absolutely. And
Cool.
we'll see in our local child advocacy center that evaluates children for sexual abuse and physical abuse. We will see them make assessments like, based on my assessment, I found this to be highly concerning for, or I found this to be just merely concerned. They won't say merely, but there's three levels. There's not concerning, concerning, and highly concerning they will use, as opposed to saying, I find the child to be lying, or I find the child to be telling the truth. So I think the way you described it would be perfect.
I use this piece with our medical students. It's called Playing God, and it's about a abuse case. And it's just a very short story. And what I like about this short story are the nuances. It's like one page, page and a half. Give it to the medical students and say, what is the narrative pieces that you see? And there's a child, they describe a child's drawing on a refrigerator where the dad, who's the abuser, is this big, giant, bully looking individual, and then mom and the children are like below, and it's like this monster figure. Um, Even those pieces of narrative, pictures, drawings, and stuff can be so instrumental as part of a whole assessment package. The other thing before just open up and let it go, I found this Franklin County Law Library on child abuse to be really, really, really helpful. I put the basically the internet account in there, the HTTP line in there for you guys. This they have done a really good job of bringing in collections of books, of papers, of Ohio laws and national laws. And so if you get a chance to, you guys have access to these slides. If you get a chance to peruse it, I was amazed of how well this page has all of the resources and live guides. I know Colleen's on here. Kudos to the librarians who do this type of work. So thank you. This is the type of stuff that is so critical. So.